If you have had a knee replacement or are about to, there's a good chance sleep is going to be one of the hardest parts, and almost nobody warns you about it. You finally get the surgery that is supposed to end the pain, and then for weeks, you can't get comfortable. You wake up over and over, and you start to wonder if something is wrong. Here's the honest truth. Disrupted sleep after knee replacement is normal. It's temporary for most people, and it matters more than you think. Poor sleep does not just make you miserable. It can actually slow your recovery and increase your pain. The good news is that most of what helps is in your control. I am going to walk you through why this happens, how long it lasts, and exactly what to do about it, including 2 things most videos on this topic skip: how to set yourself up before surgery even happens, and an honest look at what is actually safe to take, from melatonin to CBD. I am Dr. Corey Calendine, an orthopedic surgeon in Franklin, Tennessee. I perform hip and knee replacement, and sleep is one of the most common things my patients struggle with after surgery. So why is sleep so hard after knee replacement? It is not just one thing, it's several things stacked on top of each other. First, pain. Your knee is healing from a major surgery, and discomfort is often highest in the early going, especially at night when there's nothing to distract you. Second, your body has been through a real physiological stress. Surgery triggers an inflammatory and stress response that on its own disrupts normal sleep for several days and even a couple weeks. Third, if you spend a night in the hospital, the environment itself, the noise, the lights, the checks through the night, fragments your sleep. Fourth, anesthesia and pain medications change your sleep structure, the normal cycling through sleep stages, even after they completely wear off. And finally, you simply can't get into your usual sleeping position with a fresh knee. Put all of that together, and disrupted sleep is not a sign that something went wrong. It is an expected result of what your body just went through. The most reassuring thing I can tell you is that this follows a predictable pattern. Research that tracked knee replacement patients over a full year found that sleep disturbances tend to peak around 6 weeks after surgery and then steadily improves over the following months. Let me say this clearly because it helps to know. For most people, the worst of it is early, and it gets better. One study found that nearly half of patients who had no sleep problems before surgery developed new sleep disruption in those first few weeks. If that's you, you are in the majority, not the exception. Normal sleep generally starts returning within the first week or 2 as the body settles, but continues improving for maybe weeks and months from there. Knowing the timeline takes some of the fear out of it, and fear and anxiety are themselves the enemy of sleep. Here is the part most patients never hear, and it's the reason I made this video. Sleep and pain run in both directions. Poor sleep makes you more sensitive to pain the next day, and more pain makes it harder to sleep, which creates a cycle that can stall your recovery. This is not a soft claim. Studies and joint replacement patients show that worse sleep is linked to higher pain and lower return of function, and that patients with persistent sleep problems have measurably worse pain and physical function months down the road. The flip side is the encouraging part. When patients sleep better, they tend to need less pain medication and recover function faster. So here is the mistake that slows so many people down: treating sleep like a luxury instead of part of the treatment. Protecting your sleep is part of getting better, and that reframing alone changes how seriously people take it. Here is something the research is clear about that most patients never act on. The best time to protect your sleep after surgery is before surgery. Patients who go into a knee replacement already sleeping well tend to have less pain and recover function faster than those who go in sleep deprived. So in the weeks before your operation, treat sleep as part of your preparation the same way you would Prehab your muscles. Get your sleep schedule consistent. If you already struggle with insomnia, tell your surgeon because addressing it ahead of time will pay off. If you use a CPAP machine for sleep apnea, make sure it's working and bring it with you because surgery and pain medication can make apnea more dangerous. And set up a recovery space in advance, a cool, dark room, a spot to elevate your leg, your ice ready to go, so you're not assembling all of that while you're exhausted and sore. A little preparation here removes a surprising amount of misery later. So what actually works? The strongest, safest tools are behavioral, not pills. Start with the basics and do not dismiss them because they sound simple, because the evidence behind them is real. Keep a consistent bedtime and wake time, even on hard nights, because that anchors your body clock. Get bright light, ideally sunlight, and dim your lights in the evening. Keep the bedroom cool, dark, and quiet, and use the bed only for sleeping. Avoid caffeine in the afternoon and evening, and be careful with alcohol, which fragments sleep even when it helps you fall asleep. If you're lying there for more than 20 minutes, get up, do something calm in low light, and return when you are drowsy. And here is one with strong evidence specific to joint replacement: a simple guided meditation or mindfulness routine. In one knee replacement study, patients who used a short, daily meditation program slept almost an hour longer per night with fewer awakenings. For longer-lasting insomnia, the most effective treatment of all is a structured program called cognitive behavioral therapy for insomnia, which your doctor can point you towards. Now the practical, physical piece, because a new name changes how you can lie down. In the first few weeks, many patients sleep better slightly propped up or on their back with support under the leg. If you elevate the leg, the goal is to reduce swelling, so prop the whole lower leg, not just the knee, and avoid putting a pillow directly behind the knee for long stretches because keeping it bent can make it harder to straighten later. Use ice or a cold therapy device before bed to calm the swelling and pain. Time your pain medication with your care team's guidance so a dose is working as you are trying to fall asleep, not wearing off. And give yourself permission to experiment with side sleeping, usually with a pillow between your knees once it's comfortable. There is no single right position. The goal is simply to take pressure and strain off the healing knee so you can rest. What about melatonin, CBD, and other sleep medications? This is where I want you to be both open and cautious. Melatonin is widely used, has a good safety profile, and some small studies in joint replacement patients suggest it may modestly help sleep, so it's a reasonable thing to ask your surgeon about. Prescription sleep aids can help in the short term, but they carry real risks, especially in older adults. And there is one combination I want to flag clearly. Mixing sleep medications with opioid pain medicine is genuinely dangerous because both can slow your breathing. Never combine them without your surgeon's explicit direction. This is also a good reason to lean on opioid-sparing pain control, and it's one reason why I use the muscle-sparing subvastus approach and modern nerve blocks, because needing fewer narcotics tends to mean better, safer sleep. As for CBD, a lot of patients ask me about it. Be honest with yourself about the state of the evidence here. It's early, the studies are small, and the product category is poorly regulated, so quality varies widely. If you choose to try it, buy from a trusted brand that publishes third-party testing, and importantly, talk to your surgeon first, because CBD is processed by the same liver enzymes as many other medications, and they can interact. This matters, especially around surgery. None of these are a magic fix. The behavioral foundation comes first. Finally, when should this be more than a wait-and-see situation? Talk to your surgeon and ask for a referral if your sleep problems are not improving in the first couple of months, if insomnia was a problem for you well before surgery, or if you snore loudly, gasp, or even stop breathing in your sleep. This can be a signal of sleep apnea that surgery and pain medication can make much more dangerous. Persistent insomnia is treatable, often without medication, and it's worth addressing, both for your comfort and for your recovery. You do not have to just tough it out. So here's the takeaway. Disrupted sleep after knee replacement is normal. It usually peaks early and improves. And because sleep and recovery are so tightly linked, protecting it is part of getting better. Start with the behavioral basics. Get positioning right. Be cautious and surgeon guided with anything you take, and speak up if it does not improve. If you're preparing for a knee replacement and want a partner who tries to pay attention to the whole recovery, not just the surgery, there's a link below to schedule a consultation. Sleep well, take it one night at a time, and be patient with yourself. Thank you for watching.